Abdul from Hare Hills. How does it feel for me? October 2024. Could you describe your hospital experience after a stroke and provide examples of how your cultural needs were met during your stay?
I was at LGI at the beginning. When I started gaining my strength, they suggested a few things like having a bath and so on, just washing myself. I said, well, my religion doesn't allow that. I have to have a bath. So they suggested helping me, and they even got a male nurse to come and help me with. And then, of course, my religious needs like praying, which they realized that I couldn't do. Our Muslim prayers, you have to kneel down. And I tried a few times and fell over. The doctor actually sat down with me and suggested, say, you can sit down on your bed and then just do your prayer. For this doctor to actually sit down with me and tell me this, I was really very impressed. It made me feel that this person is not only a professional, she has the empathy of the patient. Then afterwards, when I came to the rehabilitation in the Chapel area, there again, a lot of people there were very, very good. Incidentally, this same doctor was also looking after me there. She always wanted to know what is happening, how am I improving. Now, when it came to serving food, you have the menu there. You point out the menu and they bring you something. I say, well, this is not the way I want it. Say, well, this is the way we serve it. But after a while, they start to realize if this person wants this way, probably we should ask them. Not everybody, every black person eats food in the same way. So I started explaining this to people. And within a short time, it just changed. The care was very good. The information I got about my health was very good. They made me feel that I'm going to be okay. So they were trying to get me back to normal, which was not very easy, but they gave me the assurance. In fact, it was there that I started using the bathroom on my own. Somebody who can hardly stand up and somebody to tell you that, believe that you won't fall down. And I did it. And I succeeded.
How was your experience after being discharged from the hospital?
Moving home was okay, but then they kept checking to see. And then later on, I was referred to the stroke group. They wanted to know what was happening and so on. We had a few visits from staff there to come and tell us what to do and so on. And that was very good.
Did you receive adequate support during your recovery at home?
Going up the stairs, I found that a bit difficult. I had to have help. When I explained this to the stroke group, the stroke group helped to have those handrails installed. The communication did not stop. The stroke group always wanted to know what was going on, and they wanted to advise me who to call, what to do, and so on. And that has been very nice.
If you could have changed one thing to make your experience better, what would it be?
The younger staff to be given more experience about the kind of patients that they get, especially in terms of cultural backgrounds. Some of them not understand. But then, with my experience with some of the young people that I've spoken to while I was in hospital, they did understand. I know the health training is there, but then the contact with the public, with the people they work with, is very important.
What one thing about your care did you really value this month?
I valued the way the nurses, the doctors cared about me as a patient, as an individual. For them to care about myself, my religion, and my culture was very, very impressive.
Thank you to Abdul for sharing his stories. Produced by Healthwatch Leeds in collaboration with Rolara.